Let's go ahead and get started today. I'm happy to welcome everybody to the fourth installment of this webinar series, New Era, New Opportunities, Making Medicaid Work for You. The whole goal of this is to make sure that dental offices in Kansas feel supported and have the structure and tools they need to be able to be successful Medicaid providers. My name is Tanya Dorfbruner, and I'm the Executive Director at Oral Health Kansas, and we are the state's oral health consumer advocacy organization. We are hoping to lead this webinar through the Pathways to Oral Health initiative, which I'll talk about in just a second, but just let me remind you, first of all, where we are in this series. If you've been with us the whole time, and I hope you have, we've covered 3 topics already. One was talking about the new Medicaid rates that went into effect over the summer. The next one was about how you can manage your own patient mix so that you know you've got a patient mix, including Medicaid and non-Medicaid patients, that makes sense for your practice. Last week, we had the great opportunity to get to know the representatives from all 3 of the Medicaid Managed Care Organizations. And this week, we are diving into a pretty meaty subject, which is enrollment and credentialing. And we'll get through a lot of logistical details with you today. Before we do that, let's just talk through logistics. And I can see a few people already put their names and email addresses in the chat, and I appreciate that. If you do, or if you are looking for CEs, if you put your name and email address in the chat, we'll be able to be sure to send you a certificate at the end of the series. Do ask everybody to use the Q&A box today throughout the presentation. Just feel free to type any questions you have into the question and answer box, and we will get to as many questions as we can. As always, we're collecting all the questions, and we will be putting together a frequently asked questions document, so you will be able to use that to refer back to. And I'll also say, as always, if there's a question we don't know the answer to, we're going to research that and be sure to get that answer back out to you. If you do run into technical problems today, just feel free to put something in the chat and staff will be able to help you. You can also email us at the email address on the screen there if you have any problems at all. So let me tell you just a little bit again about the Pathways to Oral Health initiative. This, as it says, is a project of Oral Health Kansas, but it's something we're definitely not doing alone. With our partners, we've got 3 big goals in mind. One is providing support for dental professionals to be successful Medicaid providers. That's a whole lot of the reason we're doing this webinar series. The second is around education programs for both dental professionals and for people with disabilities. And this series, again, is a part of that. And the third is a communications tool that helps break down communications barriers and helps people with disabilities especially feel more comfortable describing their needs to a dental office, and likewise a dental office feel more comfortable understanding somebody's needs. It's called My Dental Care Passport, and we will talk about that at the very last session of this series. So I mentioned that this is not something Oral Health Kansas is doing alone. We've got lots of partners involved in this work with us, and you can see you can see all of the partners on the screen here. Want to point out especially the Kansas Dental Association. You can see all of the Medicaid Managed Care Organizations and many, many other partners that are critical to this really large amount of work. And with that, I do want to say that this webinar series is co-sponsored by the Kansas Dental Association and Oral Health Kansas. It's funded by the Kansas Department of Health and Environment through an ARPA grant in their Division of Healthcare Finance. Kevin Robertson from the KDA, you're on. Do you want to welcome everybody?
You bet. Thanks, Tanya. Again, I'm Kevin Robertson. I'm the Executive Director of the Kansas Dental Association. Thank you so much for being part of this webinar series as we look to try to increase access to care to folks that might be on Medicaid, KanCare as we move forward. So thank you so much. KDA is proud to be part of this, and we appreciate your support.
Thanks, Kevin. And with that, I think we are ready to dive in and talk about today's subject, which again is enrollment and credentialing with the managed care organizations. You can see there's basically 5 steps it takes to get through that enrollment process and the credentialing process to be all the way to where you're ready to start seeing patients. So we'll be walking you through those 5 steps. And at the end, as always, we'll have several resources. We change those a little bit every week because there's always a few specific ones we want to be sure to share with you. So with that, I'm going to introduce my colleague, Brian Thompson, who is our dental Medicaid facilitator, to take it away and start walking us through these steps. Take it away, Brian.
Thank you, Tanya. And I want to reiterate your welcome. We're glad you've joined us today, and we hope we can answer some of the questions you might have. The first step, if you want to be a Medicaid provider, is to enroll through the Kansas Medical Assistance Program called KMAP. It's also referred to in some places as KMMS. That's the Kansas Modular Medicaid System. It's the web process for running the whole system. but the Kansas Medical Assistance Program is who operates Medicaid in Kansas. This next slide is the welcome page for the Provider Enrollment Wizard. The Provider Enrollment Wizard is where you enroll to become a Medicaid provider. You have to be approved by the Kansas Department of Health and Environment's Division of Healthcare Finance to participate in the Medicaid program. And if you'll notice in the top left corner, there's a name Gainwell. That's the company that manages the website. Gainwell recommends that you use either Chrome or Edge as your browser when you're going through this process. If you use a different one, it might not work the way it should. The process is fairly easy and intuitive. It asks you questions and you answer them. So I'm going to show you a few examples of what you can expect to encounter. Step 2 is to generate an enrollment pre-checklist. That's down at the bottom of that enrollment web page that we just looked at. It asks you a few questions, and I created a hypothetical example here of an individual dentist with a dentistry practice, that is, with an EIN for a tax ID. It's a non-Medicare enrolled provider and is now to the step of deciding which patients to see. So pay special attention to that last question. I will accept patients in the following programs. You'll see the drop-down gives you 3 choices. Almost all of the Medicaid population in Kansas is served through managed care organizations, or MCOs, with a few very limited exceptions. To serve them, you need to select one of the 2 options that includes MCO. So that's options 2 or 3 on this drop-down. And when you select one of the options that includes MCOs, you'll be asked later which ones you want to work with. Most people will want to choose all 3 because that allows them to serve basically any KanCare member. Once you've answered these questions, then you click the button that says Generate Pre-Checklist, the black button with the green lettering, for a customized list of the supporting information and documents you'll need to finish the application. Step 3 is to gather those documents. Now, these won't all be required of everybody that enrolled. Some of them will be, and it just depends on the circumstances you put in the questions about who you are and what you want to do. So having everything on hand, though, when you start the application, will speed the process and save headaches. And again, when you click that Generate Pre-Checklist, it's not going to show you all of these. It's going to show you the ones that you need. This next web page is when you're ready to click the Start button and get started on the actual application. You'll see a red arrow that I added into this screenshot just so you can see where the Start button is located. It's basically on the welcome page near the bottom right and just above that enrollment pre-checklist that we looked at a few moments ago. Once you click the Start button, it takes you to the registration page shown here. And this is where you receive an enrollment tracking number so you can leave and return to the application later. This last box here, provider reference, this is just something you put in if you're the one filling out the application to remind you of the name of the application so you can find it later. And so now you're ready to complete the application. That should take you about an hour. If you don't sign up with the MCOs, you will be considered an out-of-network provider. And again, you will receive a tracking number to pause and resume the application as needed. Once you've registered, then you'll begin the application itself. This is a screenshot of a dummy application that I put together just so you can see what the application looks like. This particular page is where you land after you've already gone through some of the identifying information. But you can see the reference to the tracking number up at the top. This is a continuation of that same page that has the tracking number at the top. Down at the bottom are the drop-down menus where you select which MCOs you want to work with. The enrollment wizard allows you to submit a single application to be shared with all of your selected MCOs. So I checked the boxes for all three. And that's down here in the red circle. Again, you choose your partners. There are 3 managed care organizations: Healthy Blue, Sunflower Health Plan, and United Healthcare. You can choose to contract with just 1 or 2 or all 3, whatever fits your practice the best. Once your application is approved, you get a KMAP provider ID number. The application and associated documents will be shared with the MCOs that you've selected. This takes around 1 to 2 weeks for the processing before it goes on to them. You will receive a letter. Access to the secure portal is where the providers do things like filing claims and that sort of thing. And it's controlled. That's only for providers. The secure portal requires a provider's office to identify one staff member to be the portal administrator. To register with the provider or administrator role, the administrator will need the web registration letter. I mentioned earlier that a letter will come to you, and it'll have a PIN number, and that's sent to you shortly after you enroll. And the provider or administrator is the one person for each office who serves as the gatekeeper. All the other staff who need to get into the portal, say for claims filing perhaps, they have to be authorized by that administrator. Step 5 is credentialing and contracting. This takes around 60 days, and this is a step that's managed by the MCOs, not by the KMAP. Credentialing is the process of verifying a dentist's education, license, training, and experience to make sure they're qualified to provide care and be approved by insurance plans, such as Medicaid. You choose once your contract is approved, you're ready to begin seeing KanCare members and receiving Medicaid reimbursement. So now a quick look at some of the resources we have for you. There is technical training and assistance provided through KDHE and their Division of Healthcare Finance. I've got their email address and phone number here that you can contact anytime you need help from them. They also offer training materials at the web link that's listed there. There are things like an MCO transition help document. There are training opportunities, frequently asked questions, electronic visit verification, notification of pregnancy, appeals and grievances. All these things are topics of interest to Medicaid providers that you can find at this website. We have at Oral Health Kansas, we have our project Pathways to Oral Health that also includes resources for dental providers. There's a blog where you can read articles relating to dental care and serving people with disabilities. There are provider guidance documents that cover some of the same information that we're covering in these webinars. This is all at the main link, pathways to oralhealth.org. Oral Health Kansas also has resources for dental providers. There are summaries of the benefits that are now available to adults under Medicaid that didn't used to be provided to adults. They were only for children. There's a frequently asked questions document. There's a list of dental codes that are covered in the new benefits and the rates for each. So lots of resources at oralhealthkansas.org. And I am here to help as a resource for you. So here's my contact information, and I encourage you to contact me anytime you might need some help. If I don't know the answer right off the bat, I will do some research and get back to you. And at this point, let's return it to Tanya.
Well, this is a good opportunity now to ask any questions. Brian, you may need to mute because I think I heard a little bit of an echo there, so we can just go back and forth. I don't see any questions yet, honestly, in the Q&A box, but anybody's most welcome to put something in the chat or the Q&A, and we're very happy to answer those questions. I know we threw an awful lot of information at you very quickly there, so happy to walk back through any of that or answer any questions you might have. Just give it a minute or two here.
Maybe we just did such a good job that no one has any questions.
We do have one question. And this is a good one. You had mentioned, Brian, not contracting with an MCO makes you an out-of-network provider. Are there out-of-network benefits? And I think the answer is that it affects reimbursement rates, not benefits. Is that correct? And you are muted now.
I'm not sure. Is that what the question was asking? I don't know of any non-network benefits. If you're in the Medicaid system as a Medicaid provider, it's all of the benefits that are covered, which I think, if I'm not mistaken, since the recent changes over the last 2 years, everything that's covered for adults is covered for children and vice versa. And it's pretty comprehensive now.
It's a really good question. And I think you're right. Marianne Lynch Small is our Medicaid projects manager, may have more of an answer. I also know we actually have some of our friends from United on, and if any of you know the answer to that question, the question basically is, will the MCOs pay out-of-network providers?
Hey, so I have a question that came up recently to me at the KDA, and so I hope I don't want to get too far down a rabbit hole here, but the question was from an oral surgeon. A general dentist who was a Medicaid provider wanted to refer a patient to an oral surgeon who was out of network or not a Medicaid provider. And then there was some question about whether or not they could provide that service or how that reimbursement might work or what have you. So I don't know if that's a United Healthcare maybe question that they could answer, if that's even a possibility. I just trying to get a sense of how that might work.
A great question. It's really expanding on that original question. I do see
Yeah,
somebody. Go ahead. Sorry, Brian.
I'm afraid I don't know the answer to that. That's going to take some research.
I do see in the chat somebody saying that you can bill as an out-of-network provider and agree to accept the out-of-network fee with a prior authorization. So I think it probably is a fee schedule issue more than anything else, and probably a paperwork schedule issue.
I will say
Mm-hmm.
I will say that on the KanCare website, there's a mention that providers who are out of network receive 90% of the fee for service rate.
Okay.
But I'm not certain that that's actually still valid because there's some references on that website that date back several years. So I really don't know the answer to that.
Brian, this is Kathy with United Healthcare. Are you able to hear me?
Yes.
Okay, good. So there are out-of-network benefits. The way it works is if a provider agrees to see somebody, they have to first let the member know they are not in network. And then they are reimbursed 90% of the standard Kansas Medicaid fee schedule. So we would need to provide that fee schedule to the provider. They would need to be able to review that and say, yes, we understand. And yes, we're willing to take 90% of that fee. One of the caveats is in order for that provider to be paid, they need to have a KIMS ID or a KMAP Medicaid ID for that location, or we are not able to pay them. So that does become somewhat of an issue. The provider has to determine if they're willing to register with KMAP in order to get that Medicaid ID, if that makes sense.
That makes a lot of sense. Kathy, thanks for letting us put you on the spot. Thanks for
No
being
worries.
here.
No worries whatsoever.
And I think if everybody's watching the chat too, there's some other folks in the room who are adding on and saying, yes, that is how that works. Some great insight from Matt Zabrowski at the ADA as well. So another question is, where can somebody find the fee schedules? A couple different answers, but yeah, take it away, Brian.
Well, the Pathways to Oral Health website, I showed the provider guidance documents real briefly there. And the one that says Kansas Medicaid Adult Dental Fee Schedule has been updated to show basically all the codes that are covered and the rates associated with those codes. So you can go there and take a look anytime. And there are also references on the Oral Health Kansas website to the same coverage, or you can go into the state's provider website and download the entire fee schedule. If you do that, it's a text document that is very, very, very long because it includes all of the codes for all kinds of providers, not just dental providers. And if you type in, you can do a control F find and type in a code that begins with D, and it will take you down through there. But there are many, many pages of codes if you don't sort through it that way. But yeah, it's all on there too.
And Abby just put into the chat too a direct link to the new rate schedule that came as a result of the rate increase this year. So there's what you saw, what we're showing here on the screen are links to just some of the details about the adult dental fees, but there are other covered codes that did have rate increases. So you'll see the link in the chat for the larger rates this year. Then we have another question: are the rates the same for all three MCOs? Brian, do you have an answer for that one?
Yeah, the rates are this. If that's the question, the rates or
Yes.
fees are the same for all providers.
Mm-hmm.
So yeah.
Yeah. They are the same. It is possible to negotiate different rates, but the rates are the set rates for all MCOs. Yeah.
Yeah, in the contracting process, you can negotiate, but
Lots of great questions, lots of great crowdsourcing of answers in the chat, and I appreciate that. Any other questions? Let's see. Well, I don't see any other questions coming up. I will say again, I'm grateful for all these questions, even grateful for the ones that we don't have the perfect answer to yet, because it's going to get the perfect answer ready for you. So as I said, we're in the process of putting together a frequently asked questions document that will have all the questions we're covering here and all the links you need to get to where you need to go. So that'll be coming out really soon. I think with that, we're nearly out of time. So let me just, again, give you a few other commercials for some other events coming up. We just last week started a Project Echo series with the University of Kansas Medical Center. It's the second time we've been able to sponsor this series, and it's all about helping dental teams feel more confident and comfortable serving people with disabilities. It's a 5-part series. It started last week. The recordings will be out there pretty soon, but it's not required to have to go to the next ones. You don't have to have been at the first one. So you're most welcome to register. I think that the link is in the chat to be able to learn to register for that. I do see, Abigail, just to clarify, the same fee for all 3 MCOs. Yes, that's right. It is the same fee for all MCOs. Yes. Yeah. I think we answered that in a very indirect, circuitous way, and I apologize for that. The answer is yes. The other thing I just want to share briefly is, if you've been on these before, you've seen this. But we do have a dental provider advisory group that we at Oral Health Kansas formed maybe about a year ago, actually. And this is a group of dental hygienists and dentists from all over the state. Some are in private practice, some are in community health clinics, that meet about 4 times a year and just talk through different barriers and challenges in providing dental care, especially related to Medicaid, but it can be any other issues. That group has been helping us with a lot of education we're putting together for dental offices and a lot of advocacy as well. And then the last thing is just if you're not already subscribed, we kind of encourage people to subscribe to Oral Health Kansas's weekly Wednesday update. It's a weekly e-newsletter. We try to keep it short, but it's a great digest to get kind of the latest news at the local, state, national levels, policy updates, opportunities to get involved in advocacy, lots of education opportunities. So I encourage you to scan that, and I think you actually have in the chat as well the URL to go register for our weekly Wednesday update. So next week we are back, and we're going to have all of our MCO friends with us from United, as we had today, and then Healthy Blue, impromptu United, and thank you so much again, Kathy. But next week we'll have United, Healthy Blue, and Sunflower all with us, talking through all the logistics of what it takes to file Medicaid claims. So again, a really nitty-gritty, detailed webinar, and we think you'll have a lot of great information. So make plans to join us next week. And with that, I hope everybody has a really good rest of the day, and thanks so much.